Good afternoon. My name is Student Nurse Branch, and I will be doing a head and neck assessment. Okay, so this is the patient's form. Her name is Julicia Coakley, and she was born the 14th of July, 1999. So I'm practicing medical hand washing before I assess the patient. Okay. I'm trying. Turning off the pipe. Okay, now we are going to meet our patient. First, we ask the patient their name and their date of birth to confirm that it's the right patient. Good afternoon.
Good day.
Um, this door. But before we do that, we will look around my room to see there are no prompts or anything like that. Just me and the patient. Okay. Could you please tell me your name and date of birth?
My name is Jalicia Coakley. My date of birth is July 14, 1999.
Okay. Well, today my name is Student Nurse Branch, and I will be doing your head and neck assessment. Okay. So, first I will be inspecting her head. Okay, I do not see any asymmetry. Everything is symmetrical. No sign of acromegaly. Her head is the perfect size for her body. Her eyes are in the right place, so is her nose and mouth. Her ears are symmetrical. Okay. Now I will be checking her facial expressions. Okay, could you smile for me? Could you frown? Could you puff out your mouth like this? Okay, very good, very good. Okay, now I will be checking her sinuses. Does that hurt? What about this? Okay, now I'm going to see how she does with opening her mouth against pressure. Did you have any trouble doing that?
No.
Okay, very good. That's excellent. As you can see, her skin is intact. There is turgor, everything. There is no drooping of any or anything like that. Now I'm going to check her eyes, and as you can see, her eyes are symmetrical. There's no drooping. It is pink. Her pupils are normal. Her iris has color. Her eyes are white and nice and bright. She has eyelashes and eyebrows. There is no falling off of anything. Okay. Now I will be checking her pupil dilation. Okay, could you look straight ahead for me, please? Okay, dilates as it should nicely. Okay, now I will be checking the 6 cardinal points. Okay, could you look ahead? Okay, could you, without moving your neck or moving your head, follow this pen for me, please? Okay. Very good. Now I will be testing her accommodation. Okay, that's good. Okay, now I will be assessing her ears. Her ears, they are symmetrical. There are no lesions, no bleeding, nothing like that. Okay. The inside of her ears is clean. It's the right color. There are no bleeding. There's no bleeding, no drainage, nothing like that. Okay, next I will be checking her nose. Could you? Her nose is symmetrical. Inside her nose is pink. There is no mucus, no phlegm, no obstruction, no dirt, nothing like that. No lesions or anything like that. Even the outside of her nose is clean. Could you cough on one nose and breathe in and out?
Okay.
Okay, could you do it with the other side, please? Okay, as you can see, there is no wheezing. There was no obstruction in her nose. Did it hurt to do that? Did you have any struggling?
No.
Okay, free and easy. Okay, now I will be checking her scalp for lesions, but first I will be putting on my gloves. Okay, gloves are on. Okay, as you can see, there is no lesions on her scalp, there is no bleeding, there is no dandruff, there is nothing like that. Everything is clean and pristine. Okay, now I will be removing my gloves because after every procedure, remove our glove and perform medical hand washing. I will be right back after throwing away my gloves and performing medical hand washing. Okay, I'm back. Okay, now I will be assessing her mouth, and I have to put on gloves again because, as we know, in the mouth there is sputum, and that is a bodily fluid. Okay, as I put on my gloves, I'm inspecting her mouth, and as you can see, there is nothing indicating dehydration. Her lips are not chapped. They're full in color. They're fully pink, and as they should be. Her mouth is symmetrical. There isn't any lesion, any bumps or anything like that on her mouth, which is perfectly normal, which is great. Okay, now can you open your mouth for me, please? Okay. Okay, the sides of her cheeks are clean. Her teeth is clean. I see no abnormality in her teeth. Everything is clean and white. No cavities, no decay, nothing like that. Her soft palate and hard palate are clean. Her tonsils aren't swollen. Okay, let me see. Her tongue is pink. Let me see under your tongue. On the please. Okay. Very good. No lesions under her tongue. And her tongue is the right color of pink. It is not very red to indicate any enema or anything like that. Okay. Now I'm going to throw away the gloves and I will practice medical hand washing, and when I return I will be assessing her neck. Okay, I'm back and I am now going to assess her neck. I've already washed my hands, and as there is not really any chance of coming into, because I've inspected her neck, as you can see, there's no bleeding or anything like that. I don't see any lesions. I will be feeling for lumps and masses, and as there is no bodily fluid on her neck, I do not need to use gloves anymore. Okay. Okay, there are no masses on her neck. I will be feeling for her lymph nodes. Okay, I will be feeling for her trachea. Everything is in place. And finally, I will be practicing the whisper test to her ears and using the tuning fork to assess her hearing. Okay. Do you hear that?
Mm-hmm.
Do you hear that?
Mm-hmm.
Okay. Now, I'm going to cover her ears and I'm going to say whisper something and see if she hears it.
Dogs and cats.
Okay. Very good.
Chickens and birds.
Okay, very good. Okay. When I assessed you, you didn't feel any tenderness in anywhere, nothing painful. Okay, very good. Now, there are no problems with this patient. She is perfectly normal. There is no the nursing diagnosis is that she is normal and there are no collaborative problems. So, come with me. I will be documenting that. Oh my, this door is some trouble. Before I document, I will wash my hands again because I've just finished a procedure with a patient. Okay. Now wiping my hands. Okay. Now I will be turning off the pipe with a tissue because I do not want to get my hands dirty again. Okay. Time to document. No problems found with Miss Coakley. I will sign my name and I will put the date. Okay, now I've documented, I've touched the pen, I have got my hands dirty again. I will wash my hands again. Thank you. Do have a great day.